Welcome to this course on mechanical ventilation. I'm Dr. Shauna Strickland, and I'm a registered respiratory therapist and Associate Executive Director at the American Association for Respiratory Care. The goal of this course is to provide an overview of mechanical ventilation and the patient-ventilator interaction for non-critical care clinicians. In non-pandemic times, the respiratory therapist, critical care physician, and ICU nurse work in tandem to meet the ventilatory needs of the patient. However, in pandemic times, the surge of critically ill patients may overwhelm the number of trained critical care clinicians. In that case, the critical care team is augmented by non-critical care clinicians. The staffing model that we're talking about is not part of our normal everyday routine. As we can see on the screen, the Society for Critical Care Medicine allows for a staffing model that provides a single critical care physician to oversee a great number of patients. Again, the critical care team is augmented by an expanded team of non-critical care clinicians. All healthcare providers are vital to ensuring that the patient's ventilatory needs are met. In this course, our focus is on the patient who is unable to oxygenate and ventilate on their own. We're not going to cure the patient's condition with mechanical ventilation, but what we are going to do is buy some time for the medical team to implement proper treatment options to resolve the patient's underlying condition and provide the patient time to heal until such a time that they're able to breathe on their own without the mechanical ventilator. To this end, the basic series of videos in this course will help the learner understand mechanical ventilation as a construct, how it interacts with human physiology, how to assess the patient who is receiving mechanical ventilation, and how to determine when the patient is ready to breathe on their own without the mechanical ventilator. The advanced series of videos in this course will help the non-ICU physician with identifying how to set the mechanical ventilator, how to ventilate patients who have been diagnosed with acute respiratory distress syndrome, how to ventilate patients with obstructive lung disease, and how to interpret ventilator waveforms to adjust the mechanical ventilator settings to improve patient outcomes. We will also identify how mechanical ventilator strategies may differ between patients who are COVID-19 positive and those who are not. Dr. Susan Wilcox and Mr. Tom Perino will be our guides through this series of videos. The videos were also developed in conjunction with the American Association for Respiratory Care. Thank you again for joining us for this very important course.